Passing the MRCP PACES is difficult at the best of times with all the preparation, but it is even more difficult if English is not your first language or you have not trained in the United Kingdom. The MRCP PACES is an exam designed for doctors working in the United Kingdom, and hence the marking is based on British culture. Doctors trained outside of the UK are statistically less likely to pass and require more attempts to pass. The stations most commonly failed are those of history and communication skills. I will go through tips and methods of ensuring successful stations later. Firstly, though, I will go through the reasons that many candidates fail, irrespective of country of training. If you are not fluent in English, then in the midst of the examination, when your nerves are at their highest, it can be easy to stumble or not remember words. It is also common to speak too fast, irrespective of where you are from. Yes, there is. You mentioned there was in your family history as well.
There is,
so obviously there's a worry there.
Warfarin,
but
did
don't
you
worry.
say?
Yes. This is known as verbal diarrhea. Candidates tend to overlook history and communication skills in their preparation, tending to focus on the hard clinical skills of neurology and cardiology, for example. You should spend as much time practicing communication skills as you do auscultating the heart. I will go through tips on how to overcome these issues later. Candidates are in such a rush to get to the answer that they miss the non-verbal cues and do not stop to show empathy. But with your daily blood tests, which we will give you, we'll make sure that
I'll have to have a test daily?
Yes, for your... So how exactly do you ensure you pass the history and communication skills station? The patient will likely be an actor who has been given a role to play. The actor may be primed to not be forthcoming with information or defensive.
I am the daughter of Arthur Davies. I am Louise Smith, and I want to know why my father is worse now after being in hospital than he was when he came in.
Be prepared to ask questions, and do not assume that if something is not said, it means it is not an issue. Part of the station is showing a logical thought process. Remember, a line of questioning may seem obvious to you, but can come across as random to a patient. Later on, I will go through how to overcome this. To help with this, remember starting with an open question and allow the patient space and time to answer. So what's brought you into me today?
Well, I just keep dropping things, and it's something that seems to have sort of got worse over the years.
Remember, you have 14 minutes, and if you do not fill this time, you will have to sit in silence as the clock runs out. Let's start with the history station specifically, with features that you should also keep in mind for the communication skills station. Firstly, remind yourself of the different categories that you need to go through. Start by confirming the name and age of the patient. Can I start with confirming your name and age? Then check the presenting complaint based upon the candidate information.
I've kind of got a bit of shortness of breath, I think. I just noticed that I've been a bit,
After this comes the history of presenting complaint. Ensure you pick up on non-verbal cues and ask questions, but again, give the patient space to answer them. You do not have to talk to show you understand what the patient is saying. Try nodding, sitting forward, and active listening. By talking all the time, it can come across as talking over the patient. Okay, in particular.
Right.
Things, unusual things you'll find that in.
I have to try and remember all that.
Sprouts. Oh, well, I'll give you all that information. The next section is a systems review. This tends to require short, sharp questions. Have you experienced any weight loss?
No.
Okay. Any diarrhea or constipation?
No.
Right. Have you suffered from collapsed lung in the past? Any problems like that?
No.
No. Okay. And many candidates just dive headlong into this, and it can come as quite a shock to the patient. A good method to move from one section of the history to the other is to use a technique called signposting. Can I ask you some other general questions about symptoms? Have you noticed any sweating? Another technique to ensure that you have not forgotten to ask a key question due to nerves is to summarise the section. So at this point, summarise the history of presenting complaint before signposting the systems review. Okay, just to summarise, you come in today because you've experienced a tearing pain. Also, another good tip to use when summarising is to ask if there is anything you have not asked. A good way to remember all the features of the systems review is to go physically from top to bottom. So, for example, visual defects to leg weakness and everything in between. Then comes the past medical history. Depending upon the history of presenting complaint, there are key medical conditions that you have to determine, such as diabetes or hypertension if there is chest pain. However, do not just ask about a few medical conditions and make sure to ask about surgical procedures. After the past medical history comes the medication history. Now, this is not just about what drugs the patient may be prescribed by their primary care doctor, but if they have changed recently or increased or decreased in dose. Also, any medications bought from the chemist or supermarket.
No, I take the odd paracetamol, but that's about all.
So a bit over the counter, but,
Yes.
but nothing.
Yeah.
Also, and this is key, ask about illicit drug use. If a young man comes in with chest pain, cocaine use is important. Do not do this without any signposting. Here is an example. And I do have to ask, any use of illicit drugs, cocaine, heroin, nothing like that? Okay. Finally, ask about herbal remedies, as they can impact upon the patient, like St. John's wort. After the drug history comes the social history, and this includes more than just the patient's job and whether they smoke now. When you ask if a patient smokes, do not take the first answer. Have they ever smoked? Was it cigarettes, roll-ups, cigars, or a pipe? How many have they smoked and for how long? And do you smoke?
Oh, no, I packed that up. I packed up about 10 years ago now.
Right, about 10 years ago. How many were you smoking then?
30.
A similar strategy applies for alcohol. Does someone drink alcohol on a regular basis? If so, do not ask about units. You may know how much a unit equates to, but most people do not. So does someone drink daily? At the weekend or every few days? If so, how much and for how long? Have they ever drunk heavily? Do not accept the first answer of I do not drink heavily, as everyone's definition is different. When asking about relationships and families, it can be tricky as there are now lots of different ways to describe relationships. Your language is important. As a simple question to a man, such as, do you have a wife at home, assumes the patient is in a relationship, that the relationship is heterosexual, and that it is a long-term relationship. Hence, asking the more open, do you live alone, or do you have family at home, is open enough to allow the patient to talk about their relationship and families in a non-judgmental manner. Ask about the patient's job and get an idea if their illness has affected it. Also, whether it is a desk job or outdoors one makes a difference. After the social history comes the family history, a category often forgotten by candidates. Make sure to ask an open question, such as any medical problems or issues. Do not be specific, as you may miss important features. Remember, after each section, summarize to make sure you have correctly identified all the features. At the end of the entire history, summarize the history and present a diagnosis, or a differential and brief overview of how you will proceed. What I think it is that you've pulled a muscle. And to be sure of that, I'd like to run a few tests. I'd like to do some heart tracing, an ECG scan, some basic blood tests, and a chest x-ray. If during your summary or at any point of your history you realise there was a question you missed from an earlier category, you are allowed to go back, but use the technique of signposting. In the communication skills station, specifically ask gently and in a non-judgmental way for the patient to repeat back what they have understood. We have a video specifically demonstrating good and bad practice. You will have to present your findings and summarise to the examiner and then answer questions about the condition. There is a major difference between the culture in, for example, the Indian subcontinent and the UK in the supervisor-trainee relationship. In places such as India and Sri Lanka, unless asked a question, an answer is not forthcoming and extra information is not given. This is the opposite in the UK. You will be expected to provide more information than the question may specifically request. So, for example, if asked the cause of aortic stenosis, do not just list the answers, but how you would investigate and manage them. If asked about the differential diagnosis, answer with how you would investigate them, as well as the implications. If answering only the proffered question, a candidate can appear to not know the answers. So, in summary, make sure you complete each category. Summarise. Ensure you signpost changes in a category or certain type of questioning. You can go back, just make sure you signpost. Give your patient time to speak. Do not miss non-verbal cues. Provide some empathy. Do not just answer the specific question, expand. Watch through the videos to get ideas of these techniques, as well as some of the most common conditions covered, and practice, practice, practice. Without practice, you will not pass. Good luck for the exam.